Hi, this is Brett from Parkinson Fit, and today I want to spend some time discussing exercise in Parkinson's disease. We're all told when we're diagnosed that exercise is beneficial for Parkinson's disease, but we're not really given much guidance as far as how much we should exercise, what types of exercise we should be doing. Exercise is really not exactly something that a doctor can prescribe. So in this presentation, I'm going to take a deep dive into exercise in Parkinson's disease. There's a lot of things to talk about. We're going to talk about some of the research studies that have been done. We're going to talk about some of the terms and terminology that you hear whenever exercise in Parkinson's disease is discussed. So the place to start, I think, really is with two big questions. How much should I exercise for Parkinson's disease? And what type of exercise is best for Parkinson's disease? And there aren't really any easy answers to this, but I think the place to start is to say, what did your doctor tell you? And I guess I'll start with what my doctor told me when I was diagnosed with Parkinson's 5 years ago in 2014. You never really forget your first neurologist, especially when he whispers those three magical words into his dictaphone: patient has Parkinson's. That's actually how I initially found out about my diagnosis. I'd been having an issue with a tremor that I discussed with my general practitioner for about 2 years. It was just a minor tremor in my right arm. And my general practitioner was pretty convinced it was essential tremor. But after I kind of started to develop some rigidity, thought it was a good idea to see a neurologist. So, first thing, my doctor tells me, to get in to see the good neurologist in town, it takes about 6 months to get an appointment. So before we do that, I want to send you to a sports medicine doctor and see if there might be something physically that's wrong with you. So I went to the sports medicine guy, and he ran some neck and spine MRIs, looking for issues, physical issues. Didn't really find anything. So he told me that it was time to see a neurologist. I said, my doc says that it takes 6 months to get in to see the good neurologist in town. And he told me, the other guy's not so bad. You really ought to give him a try. So I called into the other neurologist's office and had an appointment the next day. Evidently, there wasn't much of a backlog of people waiting to see him. He looked me over. He did the test where you pinch your fingers together, move your hand and back and forth, touching your nose, walk around the office, and he didn't really give me any insight as to what he thought, because the next step was to schedule a brain MRI and see if there might be something in my brain that wasn't quite right. But as I was after the appointment, after I was in the other room with his assistant on the phone scheduling my MRI, I could hear the doctor sitting at his computer talking to his dictaphone. And he said, patient, 47-year-old male, probable Parkinson's disease. And Parkinson's wasn't really something that I'd considered. It wasn't something that had crossed my mind yet at this point. So I went ahead and had my MRI, and the results were sent back to the neurologist, and I went in for my second appointment, and as I was sitting in the doctor's office waiting for the doctor to come in and talk to me. The neurologist walks into the room. He's carrying a CD or a DVD, I guess it was, and as he's walking into the room, he drops it. So I'm being a nice guy. I reach down, pick it up, and go to hand the DVD to him. He looks at it and says, "Oh, did you bring that?" I said, "No, you just dropped it as you're walking into the room." He said, "Oh, you ought to watch it." So I took a look at the DVD, and it said, Understanding Parkinson's Disease. I said, "Are you telling me that I've been diagnosed with Parkinson's disease?" He said, "Oh, yes, no, definitely." So we talked a little bit about it, and first question I asked is, what should I do? He told me to exercise. I asked him how much I should exercise. He told me a lot, as much as you can do safely. Well, is there any type of exercise that's best? Nah, not really anything. It doesn't matter. So this initial neurologist experience left me with a lot of questions. Of course, based upon the way that he handled the diagnosis, I wasn't really convinced that I had Parkinson's disease. So I made an appointment with a so-called good neurologist in town who referred me to a movement disorder specialist, and who both of them essentially confirmed the diagnosis. But I still never really got that much information about exercise. These days, when you're diagnosed with Parkinson's, you might get lucky. You might have a neurologist that refers you to one or more Parkinson's exercise programs that are in your area. Things like Rock Steady Boxing, Delay the Disease, the big program, or maybe a stationary bike spin class like pedaling for Parkinson's, or maybe a dance class, or maybe, there's also yoga, Tai Chi, lots of different options for exercise programs that are designed for people with Parkinson's. You also might have gotten some more specific recommendations from your neurologist about how much you should exercise. They might have told you 2.5 hours per week or 150 minutes. Or they might have said 75 to 90 minutes per week of high-intensity exercise. And when you ask them what type of exercise that's best, they might have given you some examples, but really the stock answer is any exercise you can enjoy and commit to doing on a regular basis. So now that we've got those answers, I guess it's really that simple, and I hope you enjoyed this presentation. But it's not really that simple. What do these recommendations really mean? Why do some of the recommendations talk about this 150 minutes and other ones refer to 75 to 90 minutes? Is there any more detailed advice? Okay, before we dive into all that, though, there's a few things that really I should say that you need to think about before you start an exercise program. You need to talk to your doctors, not just your neurologist, but you may need to talk to other irregular doctors, especially if you have a heart condition. Generally speaking, the way I look at it is if you take any prescriptions at all, it's a good idea to talk to the prescribing doctor and ask if there are any exercise concerns associated with your prescription medicine or with the condition that you're being treated for. Also very, very important, if you have any physical injuries like back or shoulder problems, get exercise guidance from your specialist. You really want to know what you should and shouldn't do with the area that you have injured when you exercise. But an important point is that exercise for Parkinson's programs are always adaptive. So, explain your conditions, any of these issues that you have, to your trainer instructor, so they can suggest modifications in group exercise classes. It's very common for people in the class to be doing slightly different variations of the same exercise because of their pre-existing conditions. Also, I'd say, use your own judgment about whether or not an exercise is safe. If it hurts, don't do it. One of the primary goals of exercise for Parkinson's is to help you avoid injury. Specifically, we're talking about preventing falls, one of the biggest dangers that people with Parkinson's face. So that's one of the primary goals of this exercise, is to help you avoid injuries. You don't want it to cause it. So just keep this in mind when you get started. And I want to talk about where these different exercise recommendations come from. This magic 2.5 hours, 150 minutes, where does that come from? Well, generally speaking, these recommendations come from many sources, and they're almost identical, coming from different organizations. Specific ones that I've looked at, that I've provided links with, that you can You'll be able to access these directly after you download the presentation. We've got the U.S. Centers for Disease Control and Prevention, the CDC. We've got the American Heart Association. We've got the U.S. Department of Health and Human Services. And we've also got the World Health Organization. And so you're really with the World Health Organization behind a lot of these recommendations. That's kind of why you see the same recommendations from different organizations all over the world. And the general recommendations, where this 2.5 hour number comes from, it's a recommendation for everyone, not just people with Parkinson's. However, that said, the U.S. Department of Health and Human Services last year modified the recommendations. The second edition of the recommendations that they've produced over the past few years emphasizes that exercise is extremely important for people with certain chronic conditions, including Parkinson's. And what they had to say about this is that physically active people who have Parkinson's disease have better physical function, including working ability, than less active adults with the same condition. These improvements have been shown with multi-component physical activity programs that included aerobic activity, muscle strengthening, and balance training activities. And those are really the three key areas that we're looking for in an exercise program. Aerobic activity, which we'll talk more about later in this presentation, muscle strengthening, and balance training. As I say, potential specific benefits of this exercise: improve physical function, including walking, balance, muscle strength, and disease-specific motor scores. So if you want to read some more about those recommendations, I've got the link here on this slide. So all these different guidelines start with a baseline or a minimum level recommendation of how much exercise you should be doing. So if your doctor tells you that you should be doing 2.5 hours or 150 minutes per week of exercise, that's what these studies are saying is the minimum level of weekly exercise you should be doing to get health benefits from it. It's also important to point out that these minimum recommendations go beyond the 2.5 hours of general exercise. They tell you that you should also be doing strength training exercises twice per week. And it's also, as we're going to see as we dive into this a little bit further, all the guidelines also include a higher level of exercise recommendations for even greater health benefits. So what specifically do these exercise guidelines recommend? Well, the minimum weekly exercise for important health benefits is to do 2.5 hours, 150 minutes of moderate intensity aerobic activity. They use the example of brisk walking. As an alternative to that, 1 1/4 hours, or about 75 minutes of vigorous intensity aerobic activity. So they give the example there of jogging or running. So that's where, I talked about in one of the earlier slides, maybe your doctor said 150 minutes, maybe they said 75 to 90 minutes. We're really talking about the intensity of the exercise that you're doing. And we're going to spend a lot more time talking about that in this presentation. So above and beyond that baseline of aerobic activity, they also recommend 2 or more days a week muscle strengthening activities that work all the major muscle groups: legs, hips, back, abdomen, chest, shoulders, and arms. Okay. We in those recommendations, there was a reference to aerobic exercise. So we're not really talking about aerobics classes here. Aerobic exercise is also referred to as cardio. It's an exercise that requires the pumping of oxygenated blood by the heart to deliver oxygen to working muscles in order to continue the exercise. Essentially, aerobic exercise increases the heart rate and breathing in a way that can be sustained for an exercise session. So the idea is that aerobic activity, aerobic exercise is something that you can sustain for a longer period of time. Examples of aerobic exercises, elliptical machines, bicycling, jogging, swimming, walking, dancing, cross-country skiing, kickboxing, many others. The other related type of exercise is anaerobic. And anaerobic literally means without oxygen. So it's a type of activity that causes you to be quickly out of breath, like sprinting or lifting a heavy weight. And if you think about this, an aerobic exercise can become anaerobic if it's performed at a level of intensity that's too high. So, if you think about it, you run too fast, you're running faster and faster, you're sprinting. Sprinting is an anaerobic exercise. So once you cross that threshold that the exercise is no longer something that can be sustained for a period of time, it becomes anaerobic exercise. There's also a concept of interval training, and this is the type of training that you see in CrossFit classes or in Parkinson's programs like Rock City Boxing. Interval training, which combines aerobic exercise with periodic bursts of anaerobic exercises. So it kind of combines the two types of exercise, which is good. All right, let's talk about moderate versus vigorous intensity. Generally speaking, when we talk about the general exercise recommendations for everyone, the ones that are not Parkinson's specific, they say that 2 minutes of moderate intensity exercise is equal to 1 minute of vigorous intensity exercise. So if we go back, think about the recommendations the minimum recommendations that I had up a little while ago. 2.5 hours, 150 minutes per week, moderate, is considered to be equivalent to 75 minutes of vigorous activity because of this 2 moderate equal 1 vigorous equation. But how do we know if it's moderate or vigorous exercise? Well, it's your heart rate that indicates the intensity level of the exercise. So it's a good idea to use a heart rate monitor to track your heart rate exercise during exercise so that you can actually measure your exercise effort so that you're not guessing about how intense your exercise is. It's also important, I talked about this earlier about things to think about before you get started. Some high blood pressure medications can affect your maximum heart rate. So if you take such medication, you really want to talk to the doctor that prescribed that medication about exercise before you get started on the program. Okay, so we've talked about the minimum level of exercise recommendations, but all these guidelines also have another level of recommendation, something that they I think it was the CDC and the U.S. Department of Human and Health Services that call this a level of activity for even greater health benefits. And the recommendation there is basically to double the amount of the aerobic activity. So their recommendation is that if you really want to see greater health benefits, you need to be looking at 5 hours of moderate intensity exercise per week or 2.5 hours of vigorous intensity exercise per week. So really, we're talking about it. If you take the weekends off, we're talking about 1 hour a day on the weekdays of moderate or a half hour a day of vigorous. And they're still talking about the same amount of muscle strengthening exercises. It's very important that you also look at strengthening your muscles all over your body. And if you're healthy, if you're really adapting well to exercise, the CDC says that more time equals more health benefits. A couple of interesting statements that from their recommendations. Additional health benefits are gained by engaging in physical activity beyond the equivalent of 5 hours of moderate intensity physical activity per week. So that last slide is not a maximum. We don't have a minimum and a maximum. There is no maximum limit of the recommendation. It also talks about muscle strengthening, the importance of that. Like I say, 2 or more days a week, you really need to be looking at activities that strengthen all your muscles. The Parkinson's Foundation also has some interesting things to say about this, and I've included the link to their page on the neuroprotective benefits of exercise. They have these different studies that they call Parkinson's outcomes projects. And they believe that through the study, they've shown that people with Parkinson's who vigorously exercise for 2.5 hours a week show a slower decline in the quality of life. And they recommend that the sooner you begin a vigorous workout after diagnosis, the better. When it comes to exercise and Parkinson's, greater intensity equals greater benefits. Experts recommend that people with Parkinson's, particularly young onset or those in the early stages, exercise with intensity for as long as possible and as often as possible. So your doctor might recommend an hour a day, 3 or 4 times a week, but most researchers think that the more you do, the more you benefit. So let's dive into how you know whether you're doing moderate or vigorous intensity exercise. It typically correlates with what they call your maximum heart rate. And your maximum heart rate is approximately 220 minus your age. So somebody that's 50 years old, their maximum heart rate is considered to be 170. Somebody that's 60-year-old, their maximum heart rate is considered to be 160. Moderate intensity exercise, and there are different definitions of this. I'm going to use a more general definition where I'm saying it's between 50 to 69% of your maximum. And I'm going to say that vigorous high-intensity exercise is between 70 and 89% of your maximum. But with studies that look at this, they like to try to hone in on more specific targets. So a lot of the studies look at a moderate intensity exercise as being between 60 and 65%, and vigorous being between 80 and 85%. But that really leaves a lot of area that isn't studied. So we're just, I think it's safe to look at these larger ranges. Just note that when we talk about studies, the studies look at more specific ranges. Heart rate tracking programs are good to use for knowing what your exercise intensity is. You can use things like an Apple Watch or a Fitbit. I like to wear a chest strap heart rate monitor. I think it does a better job of recording my activity and tracking it than the wrist ones. I mean, I use an Apple Watch too, but I think I get more out of the heart rate monitor I strap to my chest. I'm using MyZone for that, which does a good job of telling me how much time in my exercise that I'm spending at the different levels of intensity. So here's a chart just for your reference to give you an idea of what the heart rate ranges are based upon your age. The maximum heart rate being the 220 minus your age, and then the ranges for the moderate and vigorous based upon your percentage of maximum heart rate. So as I mentioned, when we talk about the general exercise recommendations, the recommendations for everyone, not just people with Parkinson's, those exercise studies believe that 2 minutes of moderate activity is equivalent to 1 minute of vigorous activity. So they allow you to mix and match your time. They just basically figure that if you're exercising at a moderate level, you're going to have to put in twice as much time to get the same health benefits as somebody that's doing vigorous exercise. When we look at the exercise studies that have been done for Parkinson's, they haven't really considered this proportional relationship. The Parkinson's exercise studies, typically what they'll do is they'll have one set of participants that don't exercise, another set of participants that exercise moderate, and another set of participants that exercise vigorous. And the moderate and vigorous groups put in the same amount of time. Unsurprisingly, the people that exercise vigorously see more health benefits, a slower progression of Parkinson's. To date, I haven't really seen any Parkinson's studies that look to see whether or not this 1 minute vigorous equals 2 minute moderate applies to Parkinson's. So the studies that have been done for Parkinson's tend to say that moderate exercise helps the symptoms, but vigorous exercise actually slows the progression of Parkinson's disease. That is, it slows how fast, slows Parkinson's getting worse. So we do want to point out from this that vigorous effort might be required for maximum benefits to Parkinson's based upon the studies that have been done. And we'll talk a little bit more about that specifically in a couple minutes. So like I just said, moderate intensity exercise does help with symptom management of Parkinson's. So it fights rigidity, it helps maintain muscle to counteract the weakening effects of Parkinson's. And there have been numerous studies that provide clear evidence that moderate intensity exercise It can improve gait. It can improve balance, help you avoid falls. It can improve tremor, flexibility. It can improve grip strength. It can improve motor coordination. It can improve your mental function. So moderate exercise is helpful. But then we've got the studies, like a series of studies known as SPARX, the study in Parkinson's disease of exercise. These researchers looked at exercise where they split the groups up into groups that exercised at high intensity, moderate intensity, and compared them against a control group that didn't exercise. And what they saw there was that the people who exercised at high intensity actually delayed the progression of Parkinson's symptoms, while moderate intensity workouts had no effect. Now, I just want to say that with a caveat, people exercised the same amount of time, whether it was high or moderate intensity. So we don't really know what would happen if we applied the twice the amount of time for the people doing the moderate exercise, whether or not that would have made a difference. But it is important to keep this study in mind. It may be required that you have to push yourself to do vigorous exercise to actually get the neuroprotective benefits. Whew, I hate this slide. I hate this slide, but I think it's important. Just to get this out up front, the D word is dementia. And I think that it is important to be aware of the fact that studies have shown that about 50% of patients that get diagnosed with PD develop mild cognitive impairment, diminished thought or executive function within 5 years of their diagnosis. And they also show that if you survive more than 10 years from your diagnosis, the majority are eventually going to develop dementia. So this is another reason, though, that we need to be talking about. We need to be aware of this. It's not a fun subject. We need to be aware that exercise is the best thing that we can do to improve our brain health, to improve our mental cognitive function. And studies, this particular study that's referenced on this slide was actually a review study where they aggregated the results of other studies that have been done. What they saw was that the aerobic activity, aerobic exercise, again, remember, I'm not talking about aerobics, I'm talking about oxygen-fueled exercise, exercise that can be sustained for a period of time. That was really the best, found to be the best to improve memory, but all types of exercise were good for the brain. One of the words that you hear a lot when we talk about this is neuroprotective. A lot of the studies say that exercise may be neuroprotective. And by this, what neuroprotective means is that it can cause an effect that may result in salvage, recovery, or regeneration of the nervous system, its cell structure, or function. So we're talking about something that is positive for the neurological system of the body. Another term that comes up quite a bit when we talk about exercise for Parkinson's is neuroplasticity. A number of studies suggest that exercise may help promote neuroplasticity. And what we're talking about when we use this word, it's talking about the tendency for the brain to rewire itself. It used to be that the medical field used to think that the brain didn't make any major changes after a certain point in time of your life, but it's now known that the brain's actually capable of changing and developing all through your life. So neuroplasticity is the term that we use to describe these kind of changes. Vigorous exercise is currently considered the best approach for encouraging neuroplasticity. There's also a lot of talk right now about another biological process called autophagy. Autophagy is a process through which the body recycles damaged cells, proteins, and toxins. There's a considerable amount of research that suggests that this normal process of autophagy is disrupted in Parkinson's disease. And I've included some references to some of the studies there. You might also be aware that that there are studies going on right now about repurposing some drugs really developed for cancer treatment and using them for treating Parkinson's disease. There's an interesting study on one of them going on at Georgetown University right now, and that's in phase 2. And one of the things that they're looking at with those cancer drugs is that they believe that these drugs may help kickstart the autophagy process, which has been disrupted in Parkinson's. But when we look at animal studies, lots of the animal studies show us that vigorous exercise promotes autophagy. So, this is one of those unknowns that we can't be too certain about, but it's another reason that possibly vigorous exercise can help with Parkinson's disease. So when you look at exercise programs that are out there for Parkinson's disease, a lot of them are really geared more toward the low, moderate intensity exercise. The ones that get into the more vigorous exercise, Rock Steady Boxing does a variation of a high intensity interval training program, alternating mixing in the aerobic and anaerobic exercises. It's vigorous exercise, and it's also good because it combines some strength training in with the program through some of the intervals. You've also got spin classes, stationary bike programs that emphasize the vigorous exercise. Running, jogging, and even brisk walking can be vigorous exercise. But if you are walking, you really want to be wearing a heart rate monitor so you can see whether or not you're hitting the vigorous zone targets. There's lots of other activities you can do. Swimming. Swimming is one that's definitely a great low impact vigorous activity. Kayaking, rowing, jump rope, mountain hiking, and various sports. I mean, there are some of the things you can look at for vigorous exercise. But I do recommend that if you are targeting vigorous exercise for Parkinson's, you use a heart rate monitor. Don't make guesses about the level of intensity of your exercise. Another concept that comes up from time to time when we talk about exercise for Parkinson's disease is forced exercise. If you think about it, vigorous intensity exercise levels can really be a challenge for people with Parkinson's disease. To achieve those higher heart rate intensity levels is difficult because you've got inherently slow movement, you've got muscle rigidity, you've got lack of balance, coordination issues, you've got tremor. You've also got the fact that Parkinson's disease usually affects people that are a bit older, so you've got unrelated conditions of advanced age like arthritis slowing you down. Dopamine increasing medication may be required to facilitate freedom of movement in order to do this. That's one of the things you find it may be necessary to take a higher dose of carbidopa levodopa in order to get the freedom of movement that you need to achieve a more vigorous level of exercise intensity. And the other thing is that you may have to adopt forced exercise strategies to reach your intensity targets. So what is forced exercise? Forced exercise is a type of exercise in which someone is forced to maintain a speed or pace of exercise greater than what they can voluntarily achieve. As I mentioned in the last slide, this is particularly significant for Parkinson's exercise because people with Parkinson's have inherently slow movement. So there's two different popular interpretations of this concept. The first one is a motor-assisted stationary bike. The motor forces the rider to move at a revolutions per minute pace that exceeds their capability. So the motor is actually making the rider go faster than they can actually move the pedals themselves. The other interpretation is the Rock Steady Boxing interpretation, where an instructor or coach, I say coerces, encourages, motivated, might be a better choice as a word, but essentially they're pushing the participant to reach a higher level of intense exercise than they would be able to do voluntarily on their own. The forced exercise story really starts with the tandem bike story. Dr. Jay Alberts is a neuroscience researcher who loves bicycling. Back in 2003, he convinced several of his friends to join him in in a ride across Iowa. The Des Moines Register has this big bike ride across Iowa called the Register's Annual Great Bike Ride Across Iowa, which is known as RAGBRAI. So one of Jay's friends brought his wife along on the ride. The wife had Parkinson's, and the intent was that they were going to ride a tandem bicycle, but they'd actually never ridden a tandem bicycle before. So after a mishap, if I'm remembering the story correctly, the gentleman stepped off of his bike without making sure that his wife was off the bike first. After this little marital mishap, Dr. Alberts volunteered to take the front seat of the tandem bike and ride with the wife with Parkinson's in the back. So I don't know if you've ever rode a tandem bike before, but the bike pedals are linked. So the backseat rider has to go at the same pace as the person in the back, or vice versa. So in this case, the backseat rider with Parkinson's was forced to pedal at the 80 to 90 RPM pace that Dr. Alberts was pedaling at. Now the surprise. Midweek, after a few days, the woman noticed a significant improvement in her PD symptoms. And it was kind of odd because some of the improvements were in things like handwriting, things that have no obvious connection to the bicycling. So Dr. Alberts thought this was pretty interesting, and he started some bike studies for Parkinson's. The first thing that he did was he designed an experiment with 10 patients and stationary tandem bikes. So they didn't actually have to ride across Iowa. They just used this stationary bikes. So out of these 10 patients, 5 were paired with power riders, cycling. They all cycled 3 1-hour sessions a week with 10-minute warm up, 40 minutes of the intense pace, and then a 10-minute cool down. So 5 of them were paired with power riders who kept this pedaling pace between 80 to 90 minutes for that high speed part. After 8 weeks of this testing, the group had actually improved their Parkinson's scores by 35%. The other 5 that were part of this study, they rode solo stationary bikes. They rode for the same amount of time, normal cadence, averaging 55 RPMs, and they got more fit. They became more fit, but they really saw no change to the severity of their Parkinson's. It is interesting to note that the heart rate intensity was similar for both groups. So the difference in effect was not related to level of intensity of exercise. It was somehow related to the speed, the pace of the pedaling, which is quite interesting. So there have been more studies that have continued. They've evolved from using tandem bikes to motor-assisted stationary bikes, things like the Theracycle. The results are consistently positive, and my opinion is that forced exercise like this and motor-assisted bikes, it's definitely something that should be considered for individuals with Parkinson's who can't achieve the vigorous level intensity voluntarily. And then we have the other interpretation of forced exercise, the rock-steady boxing interpretation, which obviously is not motor assisted. You don't strap on an exoskeleton that helps you punch the heavy bag faster. Oh, that would be interesting to see. I'd kind of like to see that. Instead, participants are motivated to achieve higher levels of exercise intensity based on the coach, the trainers motivating them. The program uses high-intensity interval training, a hit-based approach using boxing training techniques. The thing I like about it, I go to Rock Steady boxing program myself 4 to 5 days a week. I like it that it incorporates strength training and exercises and boxing and balance exercises as part of the routine. Part of the intervals include strength training and balance exercises. So it gives you a more well-rounded exercise that affects all of the different areas of muscles in your body. But the one thing I will say is that the program can vary significantly between locations because they're all independent affiliates. The coaches have been trained by the Rocksteady boxing program, but there's a great degree of independence and variability in how the programs look at different locations. And there's actually another factor that comes into play when we talk about forced exercise, particularly in the context of Parkinson's disease, and that is your medication dosage or timing of the medications that you take for Parkinson's. The reality is that this medication may be required to facilitate maximum freedom of movement. The timing of the medication may be important. You may see better results in your exercise with a higher dosage of the medication prior to exercise sessions. The higher dosage of carbidopa levodopa may actually help you move better and reach higher intensity targets when you exercise. This is really something that you should talk about with your neurologist. So as I kind of alluded to on the last slide, when we talked about Rocksteady, it's very important whatever exercise you get into that you don't forget strength training. The recommendations, the general recommendations say at least two days a week. It's probably better to be doing it at least every other day, 3 or 4 times a week. And things you want to be looking at there are arm strength. Oh my goodness. The tremors that affect your arms, they really can be helped with arm strengthening training. Free weights are good. I really like resistance bands. Push-ups are good. I hate them, but they're good. Using weight machines is okay. It's safer than free weights if you don't have a spotter, but free weights are really better for also helping you with balance, coordination, and grip. You need to look at core strengthening exercises. Ab, lower back muscles are extremely important when it comes to your balance and equilibrium. So sit-ups, crunches, planks, ab rollouts, nobody enjoys these things, but they improve your balance. They make it easier for you to recover your balance when you got a strong core, and they may be one of the most important categories of exercise for somebody with PD. Leg strength is also important. You might be doing a regular exercise program where you're walking and biking or jogging, and that's going to help you strengthen some of the muscles in your leg, but you might still have trouble getting out of a chair. Leg squats. I really think those are as important as core exercises for balance. And if you can't balance well enough to do squats, grab a chair and do repeated sit-stand exercises. That's really what we're talking about here when we talk about leg strength. Why is it important? Because you need to be able to get in and out of a chair. As you improve with the sit-stand exercises, find a lower chair or use a weightlifting bench at a gym. And if you're doing great with squats on a chair and a bench, keep pushing your rear end lower. Widen your stance. Hold additional weights while you squat. And if you get really good at it, try squats on a BOSU or a balance board. I'm going to be doing some videos about these in the coming months, but some of these balance exercises are really great for helping with some of the Parkinson's symptoms. So if you have access to gym equipment, as while we're talking about leg strength, weight machines for leg press, leg extension, leg curls, they also help because they're targeting different leg muscles. And that's really, I guess, what my point in this is that when you're walking or biking, you're only using some of the leg muscles. You really need to be looking at all of them, different areas, different parts of the leg. Exercise programs. There's also a concept called progressive resistance that I think is important to mention when we talk about strength training. And essentially what progressive resistance is it's a training method where you gradually increase the load to allow muscles to adapt. So, your muscles always adapt to whatever exercise you're doing, and they need to be constantly challenged in order to grow and to change. So as time goes on, hopefully you're going to be increasing the weight that you're going to be exercising with. You're going to be increasing the number of repetitions between rests. You're going to be increasing the number of sets. these are all ideas of progressive resistance, so slowly building up to a higher level of strength. Very important concept when we talk about strength training. So, kind of in summary, we've talked about an awful lot in this presentation. I want to give you a few thoughts, just kind of to bring it home. First off, gradually increase the amount of time and level of intensity of exercise. You just don't go out tomorrow and run a marathon. That's not going to happen. You need to gradually work up your endurance levels to increase your exercise ability. I also still think it's very important to point out that exercise is intended to help you avoid injury. It's not intended to cause injuries, so you need to be careful with it. This is one of the reasons why you gradually increase the amount of time, because if you ramp up your exercise too quickly, it increases the possibility that you're going to have an injury. Consider working with a personal trainer or physical therapist, especially if you're doing exercise outside of a training class. These professionals really can do a great job at helping you design an exercise program that meets your objectives. When you look for exercise programs, by all means, I think it's good to seek out Parkinson-specific group programs. The great thing about these is that you find camaraderie and motivation with other people that are facing the same kind of challenges you are. But if you don't have those kind of groups in your area, consider other group exercise programs for older adults as appropriate. So, again, as we summarize, I'm just going to go back to this slide that I had earlier. This is the minimum level of exercise that you should be targeting. We're talking about 2.5 hours a week of moderate intensity exercise, or 75 minutes of vigorous activity, and 2 or more days a week muscle strengthening. That's your minimum target level of what you want to be able to do in order to get some health benefits out of things. For even greater health benefits, increase the amount of time. Essentially, you're doubling the amount of time to 5 hours per week moderate, or 2.5 hours of vigorous. Keep in mind the Parkinson-specific studies, which have said that moderate intensity helps with symptoms. Vigorous activity actually can slow the progression of the disease. So you might want to steer more of your exercise toward the vigorous level. Use a heart rate monitor. Find out how intense your exercise is. So just a few concluding thoughts before we wrap this up. I think it's very important. We talked about some pretty heavy topics here, some pretty intense exercise. Try not to get discouraged. Keep in mind that any exercise is better than none. Any exercise that you can do is going to improve your quality of life with Parkinson's disease. So don't get too caught up in trying to hit these targets, especially if it looks like you've got a long way to go to work up to those targets. Try to have fun with any activities that you choose. That's really one of the great things about some of the group exercise classes. A lot of the benefit of participating in a group exercise class is the camaraderie, the sharing of the struggles that you face with people that are facing a lot of the same kind of issues. I also think it's important to remember that you got to walk before you run. It's an old saying, but higher level intensities and effort's going to produce the best results, but it's going to take you a while till you can reach those levels. So again, don't get discouraged. Just remember that any exercise is better than none. Anything you can do is gonna help improve your quality of life with Parkinson's. So we've got more information about exercise and Parkinson's at our website. We're in the process of adding more every week. So please take some time to check it out. And thanks for making it to the end of this presentation. And if you like it, please share it with somebody else who has Parkinson's, or that has family members with Parkinson's, or that works with people with Parkinson's. Thanks again.